thank you for your time to learn about AxioMed's viscoelastic disc replacement. AxioMed is a motion preservation spine platform built around a simple belief: fusion is not the future of spine surgery. Disc replacement is and will continue to grow, but only disc technologies that truly behave like the natural disc will succeed long-term. I'll briefly explain why disc replacement is inevitable, why prior attempts struggled, and why AxioMed is uniquely positioned now. In 2018, 403 million people presented with symptomatic degenerative discs. Over 500,000 lumbar spine fusion surgeries are performed annually in the US. Disc replacements are growing and estimated to replace 47% of spine fusions. After Tiger Woods' sixth spine surgery, he chose a total disc replacement to preserve motion and avoid another fusion. Fusion eliminates motion, transfers stress to adjacent levels, and often leads to degeneration and revision surgery. Patients want pain relief without giving up mobility and without fear or worsening pain. Fusion is not natural and does not work. As people live longer and stay active, preserving motion is desired. Fusion treats pain by stopping motion rather than restoring function. It alters biomechanics and accelerates breakdown above and below the fusion. Despite better hardware, the biological cost hasn't changed. Fusion remains common not because it's optimal, but because alternatives historically fell short. Disc replacement preserves motion, maintains physiologic load transfer, and reduces adjacent level stress. Like cardiology and orthopedics before it, spine surgery is evolving toward motion preservation. The market has been waiting not for any disc, but for the right disc. Most early discs used rigid ball and socket designs. They preserved motion, but replaced an organ with a mechanical joint, leading to non-physiologic load transfer, stress concentration, and long-term wear concerns. They replaced anatomy with mechanics, and adoption suffered. The natural disc isn't mechanical, it's viscoelastic. It absorbs load, dampens shock, and distributes forces dynamically. AxioMed is built on one defining insight: a disc replacement should behave like a disc, not a joint. AxioMed's viscoelastic disc replicates native biomechanics by absorbing compressive loads dynamically, avoiding hard articulation and point loading. The result is physiologic motion, reduced adjacent segment stress, and durability aligned with human biology. AxioMed isn't a single implant, it's a disc replacement platform. This isn't a first-generation idea. The lineage goes back to Acroflex in the early 1980s, then to AxioMed's founding in 2001 by Cleveland Clinic surgeons and the engineers who built Acroflex. Over decades, there were failures, redesigns, materials lessons, and manufacturing breakthroughs. Since acquiring AxioMed in 2014, we focused on long-term validation and execution. What exists today is a fourth-generation platform built on experience competitors simply don't have. AxioMed is the only viscoelastic lumbar disc to complete a US IDE with over 10 years of follow-up and no reported device failures. Peer-reviewed studies show replication of native disc mechanics and the absence of submicron wear particles seen in articulating discs like ProDisc. That long-term human data creates a moat that cannot be quickly recreated. In the US, ProDisc L is the only FDA-approved lumbar disc approved for 1 and 2 levels, generating over $100 million annually, validating demand. Other discs were withdrawn, and no viscoelastic discs are approved in the US. International attempts, including striker-backed viscoelastic discs, were abandoned. Viscoelastic discs are easy to imagine, but extremely hard to execute and sustain. AxioMed survived that learning curve. AxioMed supports anterior and lateral lumbar discs, multi-level cervical applications, and adjacent to fusion use cases. Beyond that, AxioMed X represents smart disc optionality, sensor-enabled implants now feasible with modern electronics and AI. It's a second act, not required for launch, but powerful long-term upside. Disc replacement is entering its next growth phase. AxioMed combines proven viscoelastic technology, decade-long IDE validation, structural moats built on time and know-how, minimal U.S. competition, and a multi-product roadmap. We pursue selective minority investments, SPVs for platform extensions, and view an IPO as a growth instrument, not an exit. This isn't a device cycle, it's a category-defining platform. We are led by Harvard-trained spine surgeons, a Wharton and Harvard Business School-trained CFO with JP Morgan experience, and a spine-focused CTO. Our founders have worked together for over 15 years, invested our own capital, and hold over 80% insider ownership. We took AxioMed from bankruptcy, over $70 million previously invested, raised $15 million, completed the IDE, built additional moats, and positioned the company to scale globally in 2027, aligned with investors, physicians, and patients.
Excellent results, and it's very easy to use. There's two things. It's easy to use, and you have good results. So it's very straightforward disc.
Disc replacement is no longer a question of if, only which technology will lead. AxioMed was built for that future. Thank you for your time.